why I chose hand soap and water is because my hands were visibly soiled. Therefore, that was the most appropriate choice. Otherwise, if my hands were not visibly soiled, I would use the alcohol-based hand sanitizer. The 4 moments of hand hygiene are as follows. Number 1, before client or environment contact. Number 2, before aseptic procedure. Number 3, after body fluid exposure risk. And number 4, after client contact or environment contact.
Hi, my name is Chloe. I will be your student nurse today for the 12-hour shift. Would I be able to get your name, please?
Sure. Jane Doe.
Okay, and would you be able to spell your first name, please?
Jane
And your last name?
Doe.
Perfect, Jane. Could I also get your date of birth, please?
Yes, January 7, 1977.
Okay, great. Now I'm just going to check your medical risk for you. Okay, so I'm just confirming that your name matches and your date of birth matches, and I'm also going to check your identification numbers, your medical record number. 457-6437. Great.
Vital signs are used to assess a person's health state. There are 5 in total: temperature, pulse, respiration rate, pain, and blood pressure. Temperature, pulse, and blood pressure are used to assess the circulatory system. The respiratory rate is used to assess the respiratory system, and pain is used to assess the neurological system.
Okay, so first we're going to take some of your vital signs. I'm going to measure your temperature first, okay? So we're going to measure it orally through the mouth. Okay, what I'm going to have you do is open your mouth, please, and lift up your tongue. Okay, close your mouth and keep your lips closed to hold the thermometer. Okay, there you go, perfect, thank you. Okay, so you have a reading of 37 degrees Celsius, which is within the normal range. The normal range is within 36 to 38 degrees Celsius. Okay, so now we're going to measure your pulse. Would I be able to get you to flip your wrist, please? Okay, so I'm going to be landmarking on the left side of your wrist, which is closer to your thumb, to measure your radial pulse. Just relax and breathe. Okay, so your pulse was a measurement of 65 beats per minute, which is a really good range for you to be in considering that you're an adult. So you're considered in a normal range because it is from 60 beats per minute to 100 beats per minute. And it also measured your breathing rate, so your respiratory rate. And I found out that through your respiration rate, you had 15 breaths per minute, which is in the normal range as well. For you as an adult, ranging from 12 to 20 breaths per minute. So now we're going to be measuring your blood pressure. So what I'm going to do is I'm going to put this cuff around your arm, and you're just going to relax right here, and I'll take your reading. So I'm going to be landmarking that the arrow on the blood pressure cuff will be matching within your brachial artery, which is right here. So I'm just going to close the blood pressure cuff, wrap it. Okay, just to make sure, I'm just going to put my 2 fingers just to make sure it's not. Perfect. All right. Now I'm just going to put the reading dial there. Okay. Okay, so the bell of the stethoscope is going to go where the brachial artery is. I'm going to begin rolling out the blood pressure cuff. Okay, so you had a reading of 118/78, which is a really good reading because anything below 120 milligrams per mercury for systolic is considered in the normal range, and anything under 80 for diastolic millimeters of mercury is considered good. So your reading was in the normal range as an adult. Okay, so next we're going to assess your level of pain. On a scale of 1 to 10, can you please tell me how much pain you're feeling? 0 is you have no pain whatsoever, and 10 is a very uncomfortable high amount of pain that is very intolerable.
7.
Okay, 7. So where is this pain located in terms of it?
Shoulder.
Your shoulder, okay. And what type of pain do you feel? Is it throbbing? Is it sharp?
It's throbbing.
Throb. Okay. Function of your cardiac system, specifically listening to your heart. So there are 5 different points that we're going to assess. There is the aortic, the palmaric, the Erb's point, the tricuspid, and the mitral. So just relax for me. Okay, can you wait for me, please? Next, we're going to do auscultation for your respiratory systems. I'm just going to focus on doing the anterior side of the body, and I'll further explain the posterior in another video. Okay, so I'm going to have you breathe in for me. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe in. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Hold your breath, please. Thank you. Breathe in. Breathe out. Breathe in. Breathe in. Breathe out. Breathe in. Breathe. I'm going to do an auscultation of your gastrointestinal system. So I'm going to first start in the right lower quadrant of your abdomen, then I'm going to move up to the right upper quadrant, then I'm going to move to the left upper quadrant, and then I'll finish off in the left lower quadrant. Okay, I'm just feeling for any masses in the stomach. Okay, so now I'm going to do percussion.